I found out I had HIV purely through a routine STI check. I'd had an HIV test the year before. I didn't think I needed another HIV test.
I found out I was HIV positive when I was pregnant with my second child, and I was asked by the nurse, would I like to do a HIV test, and I said yes.
So I found out I had HIV when I was admitted into St George's Hospital. I was asked if I would mind if I had a HIV and hepatitis test.
I'd been at the bedside of my friends as they were dying.
And I didn't think anything else of it. I was admitted into hospital, and 4 days later they turned up at my bed and told me I've got HIV.
It was a shock that this had happened to me.
I did not expect to be here now. I knew that I was lucky that medication was around, but it was such early days with medication. It wasn't proven over a long period.
I was a bit biased about who had it and why they got it before I was diagnosed. I believed that it was people who were gay or African who were going to contract HIV. I'm a British, first generation, British born Caribbean.
It's a really hard thing to take in when you're not expecting it. And I just felt crushed, isolated, suicidal. Thought, you know, this is a death sentence. How am I going to recover?
HIV has changed big time.
The medication, the support, the information has grown.
The science has come on so much that we don't have a cure yet. Hopefully one day there will be, but there is treatment for the virus.
Medication nowadays has advanced so much. I take one tablet once a day. It has 3 drugs in it and gives me no side effects whatsoever. I live a totally normal life.
And you choose whether you take them in the morning, at lunchtime, in the evening, and that's all I have to do.
I had a really good midwife who explained that if I took my medication, I would not pass on HIV to my child, and that I could have a natural birth.
The medication suppresses the virus in your system. So it suppresses it so much that it is what they call undetectable. And that means that I cannot pass it on.
Since having my child, I knew that I could have more children, that I could go on to have partners and still have a sex life. And I'm currently with a partner who's not HIV positive. And the fact that we've had unprotected sex for the last 5 years and he doesn't have HIV, it proves that this is working, that the medication works.
It's scientifically proven and it's fantastic. It's now important that we encourage everyone to know what their HIV status is. Because if you are HIV positive, it's not a problem, you'll go straight onto medication.
Things that I'd like people to know about HIV would be that it's not as scary as it sounds.
We're stuck in what we were told in the past.
HIV is not a killer any longer. It's something that we need to be aware of, and we need to break through the poor media focus that we have on HIV.
And it shouldn't be that way. We have made amazing strides.
Someone who's living with HIV is living with a chronic health condition, the same as other people's health chronic conditions, that you're not contagious because of the medication.
The thing that I think most people don't actually realise that the H in HIV stands for human being. It can affect you too.
It is only interested in the fact that we're human beings. It is not interested in sex, colour, creed, religion, whatever.
If I had 15 seconds to summarise living with HIV, I thought it was the worst news I'd ever received. And now I've learnt that, yes, I would rather not have HIV, but it is a manageable, treatable health condition that I cannot infect anybody. And if everybody got tested and everybody was on treatment, HIV wouldn't be passed on.